Hello, my friends. My name is Jessica Friedman. I am a childbirth educator and birth doula and a spinning babies certified parent educator. I am also the founder of Mama Shakti Prenatal, and we are going to talk today about 3 grounding techniques that you can do during childbirth to help you break out of the trauma cycle or the trauma loop, also sometimes referred to as the fear, pain, or fear, pain, tension cycle that our brains and our bodies can get into during childbirth. So, when I'm supporting mothers and families during childbirth in birth support, I will often see this trauma loop take place. And what happens is the contraction pain or the fear of the unknown kind of takes over their brain, and they start worrying and thinking about how much worse it's going to get or what's to come. And then that worry and fear causes their body to tense up and to become more painful. And then they become more fearful. And that loop is a vicious cycle that just keeps going. So, you have read likely my article about ways to prevent birth trauma in your childbirth experience, but now we're going to talk about how you can actively break that trauma loop or that fear, pain, tension cycle during childbirth. So, you will likely want to watch this video with your spouse, husband, partner, birth support person, whoever is going to be supporting you in your childbirth experience, so they can help recognize when you get into this cycle, and they can help guide you out of this cycle, because sometimes it is hard to get ourselves out of it if we're in it. But if you have a loved one who is watching you and can say, hey, I think you're in this cycle, let's do these 3 things to help break it, you'll be on the road to breaking that trauma loop. So the first activity that we're going to do is called tapping. Now, there is a specific point protocol for tapping on the meridians of the body that help with embodiment practices like trauma processing. We're going to do an abbreviated version of that tapping. So you can do this to yourself, or you can have your partner do it to you, and you take 2 fingers or 1 finger, and you're going to tap right in the center of your forehead on the crown of your head. And you're going to tap hard enough so you feel the sensation, but not so hard that it causes you pain or discomfort. And you're going to close your eyes and breathe in through your nose and out through your nose steadily. Taking a deep breath so it fills your chest and your belly, and then breathing out. And we're going to tap on each meridian point for 3 of those breaths. And then from the crown of your head, you're going to move to the center of your eyebrows, and you're going to tap right there. And you can use 1 finger if 2 fingers does not feel comfortable. And you're going to, again, tap here for 3 breaths, in through nose, out through nose. Then you're going to come down here to the space between your nose and your upper lip, and you're going to tap right in the center of that space, 3 breaths, in through nose, out through nose. And then you're going to come to the chin, right below the lip, where that little crease is in the chin, and tap there, 3 breaths. And lastly, you're going to come down to the space in between the breasts, right on the breastbone, and you're going to tap here for 3 breaths. Now, if you're feeling very overwhelmed and you feel like 3 breaths is too much, try that point protocol: crown of head, center of eyebrows, upper lip, chin, heart space, for 1 breath. And then once you find yourself starting to kind of ease out, do it again for 3 breaths. And this will really help to draw you out of that cycle. The second thing that you will ask your partner to do is have you do the 3, 2, 1 grounding technique. And this is when they ask you to visually spot 3 things in the room. So your partner will say, tell me 3 things that you see right now. Bed, chair, window. Tell me 2 things that you hear right now. monitor beeping, air conditioner turning on. Tell me one thing that you smell right now. Essential oils, alcohol pads, something that is in the room that has a very noticeable smell. That is the 3-2-1 grounding technique. So 3 things that you see, 2 things that you hear, 1 thing that you smell. And we're activating the senses to bring us back into the present moment to get out of that future projecting cycle of fear. Then the third thing that you're going to do is move. And we're going to do movements like shaking. So, if you're ever at a fair or someplace and there's no more paper towels and you just wash your hands and you want to fling the water off your hands, you fling or shake those hands and let your hands be really heavy. So you see that my hands are just kind of like not doing anything, and I'm initiating that movement through my arms and letting my wrists be limp. This, and then bouncing and shaking the body helps to reset your nervous system. So if you are able to stand, if you haven't had an epidural, you can do all these things standing, which I love to do. But if you're in your bed and you're limited to movement, do those things. And if you are able to stand, do these things, but add some shifting of your weight from side to side into one foot and the other, gentle bend in your knees. You can also gently stomp your feet. You can find yourself inhaling and swinging your arms up and exhaling, swinging your arms back, inhaling up, exhaling back, inhaling up, exhaling back. You can twist and let your arms fling. This is really great to do when you're standing. Let those arms be heavy and twist. And this is good movement for your rib cage and your diaphragm so you can breathe better. You can circle. Circle is another one of my favorite movements to help soothe your nervous system and break you out of that trauma loop or the fear, pain, tension cycle. And really, any movement that comes to you that is feeling intuitive, I invite you to really tap into your intuition. But sometimes if we're caught in that loop, intuition can be maybe a little cloudy. So have your partner guide you in movements that you've practiced together prior to your childbirth experience that help you feel like you can come back to the present moment and like you can release any traumatic feelings of overwhelm, fear, anything that could be having a potentially negative impact on your childbirth experience. So those are my grounding techniques to help you have an empowered labor. And if you have any questions, please drop them in the comments. Again, my name is Jessica with Mama Shakti Prenatal. If you have not read my newsletter yet on how to avoid birth trauma, please leave me a comment and I will make sure to get you the link to sign up for the newsletter so you can read that article. Thank you so much.